I'm going to talk about some public health issues. Really, I'm going to touch on three things. Number one, I'm going to reflect on how I see public health issues unfolding in the current world, intersecting with transportation planning priorities. Number two, I'm just going to share a smattering of other little, I call them factoids, that I've been picking up that inform my approach to this. And then Gina talked about how the presenters don't represent MnDOT or the university. For the last third, I don't represent Blue Cross in Minnesota. I'm really speaking for myself. The first two sections just provide a little background on why I'm going to itemize the issues I itemize. How many of people in the room have seen the CDC slides on obesity? Maybe half. Okay, there's a wonderful stream of slides going from 1985 up to 2009 that, taken as a whole, tell a dramatic story about how the American population is increasingly overweight and obese. These are three snippets from that time series. Back in 1990, you'll see that no state that was reporting data had a population that was more than 10 to 14% obese. Fast forward to 2009, and we have a significant number of states, principally in the South, colloquially known as the Stroke Belt, with a percentage of the population greater than 30% being obese. This is a big deal. Pun not intended, sorry. But thinking about Minnesota specifically, the Minnesota Department of Health estimates that for 2010, roughly $1 billion of medical expenditures in the state of Minnesota are related to conditions associated with poor nutrition, physical inactivity, overweight, and obesity. We can wrap those up as a bundle. Nationally, it's $147 billion. So one could argue that Minnesota is doing better than the average, but really not. We still can't afford it. Anyone who is overweight or obese costs the system more, costs us more within the state. And more disturbing is that if the past 10 years of experience continues forward to 2020, within Minnesota we'll be spending almost $4 billion on clinical care associated with these conditions. These conditions are by and large avoidable. So in the face of budget constraints, this is an opportunity to bend the curve. And healthcare, these are national figures now. Compared to transportation budgets in the United States, healthcare is a bigger horse. We need to bend this curve just to allow, well, Tom Gillespie was referencing the desirability of productivity. We need to diminish morbidity and diminish the percentage of the economy devoted to the treatment of clinical conditions. My work at Blue Cross has allowed me to become increasingly familiar with transportation agendas, and there is an opportunity to try to use modifications in transportation policy to bend that curve on the health front, rather the medical front. Now, this is an international comparison of per capita health costs, country to country. Down there on the bottom, the U.S., on a per capita basis, we're clearly spending a lot more adjusted dollars based on 2010 estimates. Transportation and the relationship, 2008 data. I find this fascinating. Left-hand margin, you have the USA with the lowest percentage mode share in bike, walk, or transit. More active modes. Transit, we consider to be an active mode of transportation because you're a pedestrian at one or both ends, or otherwise moving your body to get around somehow. There's an inverse relationship between the percentage mode share, bike, walk, transit, and the average percentage overweight and obesity within those countries' populations. So what can we learn from these folks? Well, and what's the potential for switching modes within the United States? From the 2009 National Household Transportation Survey, 28% of all trips are 1 mile or less in length. For a healthy individual, in the proper environment, that should be walkable. 40% are 2 miles or less. and over 50% are 3 miles or less. So that's where walking and bicycling represents an opportunity in our book. Blue Cross, some of you may have had some exposure to Nice Ride, the bike share system in Minneapolis, where that's one of the programs that we're investing some of our resources in. We're also working with a number of communities across the state to assist them in updating planning for their municipalities to, as the introduction said, help make biking and walking a more viable choice. Our motivation, this is the aphorism that we hang our hat on, we're trying to make the healthy choice the easy choice. That's not to say everyone needs to bike and walk, but to the extent we can get a larger percentage of the trips into those modes, we think we'll be making progress. Now, some other points of information. Specifically, I want to talk about fuel costs, economic development issues, and personal safety issues. This is up until the end of March 2011, 6 years worth of data on average gasoline prices in the US. You can see the recession there. In late 2008, it sets in, and then it starts to creep back up. How many of you expect to see gasoline at less than $1.50 again? I agree with you. I don't anticipate that. And I've heard it said that we're not out of oil. We won't be out of oil for a while, whether or not you agree with the notion of peak oil. But the fact of the matter is we're out of cheap oil, inexpensive oil. This is a sheet comparing the production cost per barrel of oil for various sources. Conventional oil, $9 production cost, down there at the bottom. Oil shale, if you heard of fracking or those other ways of extracting gas or other petroleum distillates from the soil, that gets up to $57,000. How many of you have heard of the tar sands in Canada and their proposal to get a pipeline running down to the Gulf Coast? Tar sands heavy oil, that's $23 a barrel for production. So we're basically talking about tripling production costs. Implications. These data are a few years old. I forget what year specifically, but the Center for Neighborhood Technology has done a comparison of what percentage of household income for a few income levels, what percentage is devoted to housing and transportation, the red segment of the pie, versus all other. For those who make $35 to $50K a year, 63% goes to other, 37% goes to household and transportation if they're living in an urban area. Higher density, more mixed use. Suburban, it's roughly 50-50. Rural, still roughly 50-50. We drop down to a lower income level, 20K to 35K. Workforce housing, this touches upon equity issues. In the urban environment, 54% of the household budget goes to housing and transportation. Suburban, we're approaching 2/3. Rural, just a skosh higher. So that was assuming $2.60 a gallon. So let's assume those data are 3 years old. What if gas were to go up to $5.20 a gallon? What if we were to rely on some of those new sources of petroleum? It's probably going to be higher than $5.20 a gallon, I suspect. So again, 35 to 50K, suburban at $2.60, 50%. At $5.20, a little bit higher. Suburban, those were urban, excuse me. Suburban, we're up to 66 at $2.60, and it goes up to 3/4 of the budget goes to housing and transportation at $5.20. Bring on the electric vehicles, please. It's an opportunity. And then, actually, I just came across this last night. The National Association of Realtors just released their 2011 Community Preference Survey. I've got the sheet over there. But they had 7 major points in their summary. Number 1, the economy has influenced attitudes. Duh. If anyone's been paying attention, that makes sense. Interesting to me is that increasingly, a majority, Not a huge majority, but a majority, something like 55 to 60% of respondents out of this survey, with over 2,000 respondents, describe the ideal community as having a mix of houses, places to walk, and amenities within an easy walk or drive. The population on average, as surveyed by the National Association of Realtors, is tuning in more to the desirability of being able to walk to avoid hopping into the single occupancy motor vehicle. Working against this is an interest in privacy. Privacy is important to folks, but it turns out that when they have to factor in commute requirements to live, if they have to live further from a job, they're willing to sacrifice the size of the yard, they're willing to sacrifice the size of the property, the house. They're willing to fudge on these issues. Community characteristics are increasingly more important than home size. They'll define the nature of the community that appeals to them, and they'll be attracted to that. That is a more significant factor than hitting a target square footage. And they're also temperamentally inclined to improve their existing community and also modify infill development. That's increasingly popular philosophically. I was actually surprised to see that. And not surprisingly, community preferences varies by age and politics. Younger folks, Generation X, they're much more inclined to go urban, higher density, mixed use, with a focus on bikeability, walkability. And the more liberal and progressive political inclination, regardless of age, is more inclined to move to a more urban environment. Okay, shifting gears, we're now going to talk about public safety. On the left, you'll find, and these are in rank order, the 5 things that worry parents the most: kidnapping, school snipers, terrorists, stranger danger, drugs. What actually contributes to death and injury for kids under the age of 18, number 1, car accidents. I've heard it said that the single most dangerous thing your child can do is get in the car with you. A stark, perhaps, overstatement, but nonetheless evocative. Homicide, and homicides typically perpetrated by someone who knows the child. Child abuse, suicide, drowning. So, I do not have off the top of my head the mode share of trips on foot versus in a motor vehicle, but for 2008, 15% of all fatalities in the U.S. were pedestrians. That touches on an issue and something that's going to influence my articulation of desires going forward in the Minnesota Go process, is pay more attention to the safety of those who are not wrapped in a steel cocoon. Pedestrian survival rates and vehicle speed. Think about this relative to your residential neighborhood, wherever you live. If a pedestrian is struck by a motor vehicle going 20 miles an hour, they have a 95% chance of surviving that collision. Up the speed to 30 miles per hour, the typical neighborhood speed limit in Minnesota, and I've heard this called Vegas odds. It's a 50-50 chance of surviving that collision. Take it up to 40 miles per hour, 85% chance the pedestrian is dead at the scene. So slowing things down makes a lot of sense, or incorporating sensors that prohibit things. There's one state, I forget what state, some draft legislation has just been brought up. I think it's out east. They're talking about imposing some limit on drivers passing bicyclists only being able to be 15 miles over the bicyclist speed. How that's going to get measured, I don't know, but an interesting thing. So, okay, this is all of that serves as pretext and context for identifying what I would start a discussion with in terms of what my priorities are, thinking about transportation planning within the state of Minnesota. Number one, provide real travel mode options. To the extent we're able to build out the transit system, I think that's a good thing. To the extent we're able within the existing right-of-way to better accommodate the non-motorized modes as well as the motorized modes, I think that would be a desirable thing. It's also reflect on that National Association of Realtors data. It's also increasingly what the younger generation, the markets we need to be catering to what they desire. Emphasize accessibility over mobility, rather than being able to get from point A to point B at the highest speed. Let's pay proportionally a little more attention to accessing destinations of interest. Integrate transportation and land use planning. This touches upon the economic development angle, which is the subject for, I believe it was yesterday's session. But I think making sure we're not planning our state through multiple silos of investment and thinking, making sure they're integrated. Focus on economic development and community vitality, and enhance the safety across all modes, and learn from others, just general principle. That's me, and I'm done.
All right, thank you, Michael. Actually, I'll have you stay up and we'll see if we have any questions. So we've got a microphone here. If you could raise your hand, and when you ask your question, if you could also tell us who you are before you ask the question. So any questions for Michael on his presentation? All right, right over here.
Michael.
Hey.
Sharon Piper with the Department of Natural Resources. I was up in Edmonton, Canada this past summer, and heard a little bit about the tar sands from multiple presentations up there. But I was just curious, the figures there that you present, dollar figures, do those take into account the extreme negative externalities in terms of air pollution, water pollution,
No.
and complete land degradation?
No, this deals only with production costs. There are all kinds of negative externalities. Reading this week about the proposed, what do they call it, Keystone XL or VL? I forget what the pipeline from the northern border down to the Gulf Coast would be. But it's kind of a scary proposition when you look into the environmental hazards associated with a rupture, and the product of the tar sands process that would be piped through is more corrosive than typical crude. So,
yeah, and extreme health costs too. When I was there, there had been a release in the middle of the night, and 400 people in this small community had to be evacuated because they couldn't breathe, and that was from the production facility. So I think one thing we never think about are the full costs associated with those negative externalities, and we're going to drive ourselves bankrupt if we don't start incorporating those costs into everything we do. So, okay, so just production costs.
yep,
Yeah.
that's it.
Other questions?
And I'm going to participate in the rest of the day, so if you're shy, feel free.
All right, thank you, Michael.
We actually have.
Oh, we do, okay. We've got another question.
Sorry about that. One more for you. You're not off the hook that easy. Bill Noondorf with Transit for Livable Communities.
Hi, Bill.
The staggering increase in the obesity rates is pretty shocking when you see the progression over the years. What does the research show are some of the leading reasons for that? It's not just one or two things, but if you could tell us a little bit more about what contributes.
That is a subject of great contention. The increase in the number of hours people spend commuting, driving, is considered to be one significant factor. There are some who think that changes in the dietary habits are another contributor. Another interesting line of argument comes out of the RAND Corporation. Roland Sturm is an economist at the RAND Corporation. Back about 5 or 6 years ago, he did an interesting little study reflecting on obesity, and he found out that over, I think, a 10-year period up until the early part of this decade, this is counterintuitive, but American households had doubled their expenditure on fitness equipment, exercise equipment. But then he also found that they had quadrupled their expenditures on electronics, home electronics. So there's a lot more screen time, computer or TV, a lot more time spent in commuting. I didn't bring up a slide. Digressing from the obesity issue, those are the leading contenders. But at the beginning of March, the American Public Transportation Association published some figures, city by city, what an individual could save, what a household could save if they did not use a private car and use public transit. Within Minneapolis, the annual savings for a household was something like $10,300. Not selling the car, just not using the car. So, I don't know, just another factoid. Don.
Hi, Michael. Don Hickman, Initiative Foundation. This really isn't directed at you, but it's a challenge for all our speakers. Some of us choose or have to live in rural areas where new urbanism and infill really aren't options. Any wisdom on how we're going to adjust to these realities, and how do we plan for that to minimize some of the threats we've heard about this morning?
I do not have the golden answer to that challenge. It is one that we talk about back at the office with regularity. Most of our programs, or a significant percentage of our programs, are in Greater Minnesota. The opportunity within Greater Minnesota to pursue, let me back up. Randy Neufeld is associated with the National Complete Streets Coalition. His parents live in Mountain Lake, Minnesota. Randy he's been in Chicago for 20, 25 years. When he goes to Mountain Lake, he says Mountain Lake is actually they don't need to redesign anything. It's a good place to live in terms of accommodating multiple modes. You can walk, you can bike down the middle of the street. It's not a challenge in that regard. In terms of the economic sustainability, I think to the extent that you've got some number of towns that serve as a county seat or centers of economic activity, concentration to the extent possible within those areas. Agricultural production has its own requirements. It's just part of the trade-off of making that. It's a work in progress. I do not have a good answer. But I do not think I'm suggesting there should be a diaspora from Greater Minnesota. It's just we have to come up with strategies that are tuned to that environment. Uh-oh. Joe, where are you? Jill. Oh, sorry.
Into that discussion, this idea around within a rural community, look at maintaining some density within town, but also when agriculture or agricultural land is being sold off, that it's not going into suburban development. And that's what we're seeing across the state, is communities where they're going away from their downtown. And so there's some strategies that can be infused in there that look at transportation, look at the land use, while still maintaining and preserving that rural model, and what are the qualities about that. But like a lot of the rural examples are becoming suburban examples just without a major metropolitan area, and they're not winning, they're struggling, so.
But also, another little factoid that's tucked in the back of my head is folks who are nearing retirement age, of something like 60% are oriented toward moving to a more urban environment. Something like 15 to 20% are oriented toward a more suburban environment. The balance are oriented toward a rural environment. So there's still some demand for that. How that's accommodated, if fuel prices or fuel alternatives could be generated within an economically viable model, that might reopen the doors, then we'll have other reasons to argue for concentration, preservation of green space.
Michael Peter Wigenius from Mayor Ryback's office. I liked your presentation. I was actually interested in your thoughts on the previous presentations. We got two really different perspectives on intelligent transportation systems. One of them from the University of Minnesota and one from GM. And I just wanted to point out something and ask your comment on it. The University of Minnesota perspective on ITS clearly highlighted that there was going to be safety advantages out of ITS, and I agree with that. They didn't seem to think there were going to be a lot of capacity advantages out of ITS, which I also agree with. He made a reference to maybe being able to narrow lanes on freeways. But I wanted to contrast that with the GM presentation, which, in my view, fantasized about the idea we were going to get people into these enclosed segways, and that maybe we could get fully automated freeways. And I think that ignores human DNA. Are humans willing to give up control of their automobiles? Are humans willing to get inside a vehicle like that on a freeway when there are presumably still semis on the freeway? What I liked about your presentation is you talked about human beings and how they interact with transportation. Isn't there a downside to this ITS stuff, that it's some Shangri-La where someday we're going to get an incredible amount of people in these tiny vehicles, in smaller lanes, in with semi-trailers on freeways, and therefore we don't have to do the things that you were talking about, integrating land use and transportation, making real transportation choices, making real choices with our transportation dollars? Isn't there a danger that that dream stands in the way of us making the kind of decisions that you've talked about? I mean, and related to obesity or an aging population or these other presentations.
I'm kind of a geek, so the ITS aspirations appeal to me. But the timeline on which they will be available is protracted. They're not going to be addressing issues that we need to be sensitive to, and I believe responding to, within the next 5 to 10 years. The issues of human psychology and the willingness to hand over control. There are some interesting experiments going on with caravanning of automobiles. They get behind a larger vehicle, and the computer locks them in, and then you can bail out when you get to near your destination of choice. The idea of building in sensors that limit collision potential, very cool, regardless of the fuel source, regardless of the size of the vehicle, to the extent that that becomes a norm, whether cultural or through legislation, regulatory controls. I think that would be a positive thing. I'm not as pessimistic about the longer term opportunity for ITS visions to be brought to fruition, but it's just going to take time. So, cautiously optimistic about ITS. That's how you can portray me. That, and I see Max too often.
All right, thank you, Michael.